It's that time of year again when the holidays are upon us and there seems to be lots of cheer and excitement in the air, right? Well, one thing that isn't talked about enough is the increase in depression and anxiety for millions of Americans surrounding the holidays. We're joined today once again by Dr. Nate Upshaw, Medical Director at NeuroSpa TMS. Good morning. Good to see you. I'm so glad we're talking about this because I do think this is an issue that a lot of families, a lot of people are struggling with this time of year when we're supposed to be happy, right?
Yeah, so the holidays are a time where we're supposed to be with our loved ones and celebrate, but oftentimes people are overscheduled and they're trying to make these commitments and keep these commitments, and it just leads to more stress, and it can lead to anxiety and depression.
Yep, and I think people are struggling with maybe loved ones that aren't here, and there's just so much pressure, I think, that we put on ourselves to make the holidays extra special. Talk about a little bit about the number of people suffering, whether it's the holidays and all throughout the year, though, struggling with depression. I mean, this is a huge number. Yeah,
so 1 in 5 people are going to have a depressive episode at some time in their life. And around the holidays, people who are predisposed to depression, the stress of the holidays could trigger an episode, or if you're already struggling with depression, the stress of the holidays can sometimes make your symptoms worse.
Talk about how you treat depression, though, and it truly is unique, and I think, which is why you're on the show, is getting the word out about what you are doing differently. Talk about your treatment plans and what...
Yeah, so at NeuroSpa, we use TMS therapy to treat depression.
Okay.
And TMS uses magnetic pulses to stimulate specific areas of the brain that are out of sync.
Go ahead, and while we're talking about this, let's show the chair, because this is essentially what people are sitting in, and this is how you treat it. So,
right, so that's a picture of the chair that we use, and it's pretty comfortable, and there's a magnet that just sits on the top of the head. And I think there's another picture of 2 brains, one showing on the left depression, and the one on the right is a normal brain, which someone who's not suffering from depression. You can see the difference, and what we do with TMS is we target those specific areas that are off and we treat them, and it's without the side effects of medication. The other thing that's important to remember about this treatment is that it's FDA cleared since 2008, and it's covered by most insurances, including Medicare. So this is a mainstream treatment that's been around for a while, even though not everyone has heard of it.
Yeah. So those watching this morning, and again, because we know a lot of people struggling with this, what if you're already currently on antidepressants? I mean, what's kind of the process? What happens, as you're talking with patients that come in?
Right. So I encourage anyone who's suffering from depression, whose medications aren't working, or they're thinking about medications, to contact us, because wherever you're at in the process, you can start TMS treatment and it can work for you. And so especially this time of year is a great time to get in touch with us, because a lot of people have already met their out-of-pocket expenses for insurance, and some people are able to get TMS without anything out of pocket. So it's a great time to consider this treatment if your other depression treatments have not been working.
Yeah, we have a little over 30 seconds left. What's your take home, for people watching this morning, and again, who are just looking for relief and for that hope?
Yeah, our big take-home message has always been, if you're suffering from depression and what treatments you have had tried haven't worked, you should really think about trying TMS therapy, because again, it's a mainstream treatment that can give very different results than medication. And that's been one of the big things that I've seen in my practice, is that the results are different than when someone responds to medication. So it's a really different type of treatment that's available.
All right, well, let's go ahead and put your contact information up. I think people are going to be very interested to learn more. We're so happy that you're a part of our show. Again, there is the number to call. Certainly check them out online as well. But we appreciate your time. Thank you so much. We look forward to seeing you soon.